Good evening. I'm Mayor Ron Nirenberg with Bexar County Judge Nelson Wolff, and this is our COVID-19 update for the San Antonio community. Tonight we're reporting 1,676 new COVID cases, which brings the total to 148,555 since the pandemic began. Our 7-day rolling average remains above the 2,000 mark at 2,071 tonight. Sadly, we also have 3 new deaths to report this evening: one Hispanic male in his 80s, one Hispanic female in her 80s, and one white female in her 90s. We've now lost 1,809 of our neighbors and loved ones to this virus. Please remember that your actions have the potential to have life or death impacts on someone else, someone maybe close to you. Please continue to follow the safety protocols to protect those who are most vulnerable in our community, and please keep those families in our prayers tonight. After several days of declines, unfortunately, we also have COVID patients in the hospital, an increase in the COVID patients in the hospital the last 2 days. Tonight, there are 1,439 patients being treated for COVID-19 in local hospital, which is an increase of 45 since yesterday. There are also 130 new admissions in the last 24 hours. There are 436 patients in the ICU and 244 on ventilators. Very quickly, we talked a lot last night about our frustration with the vaccine distribution process nationally at the state level, and we do have, unfortunately, an announcement regarding vaccinations scheduled for tomorrow at the Alamo Dome. Due to the shipment of COVID-19 vaccines supplying Monday's scheduled appointments being delayed from Pfizer, as a result, all appointments scheduled for Monday at the Dome will be rescheduled for Wednesday, January 20th. At the same times, and of course contingent upon delivery of those doses, we do apologize for the inconvenience, but these doses that have been allocated to us by the state have not been shipped to us from the manufacturer as they were supposed to be. We are hopeful that the shipment will arrive in the next 24 to 48 hours, allowing us to proceed with the vaccinations on Wednesday, and we ask for your continued patience. Individuals who are scheduled for an appointment for Monday will receive further communication through the email address or phone number provided with their registration. Let me turn it over now to Bexar County Judge Nelson Wolff.
Mayor, thank you. And yeah, it is very, very frustrating on getting the vaccines here. I don't know what's wrong up at the national level, but it's never been in a good shape since this thing started. Our Bexar County Hospital District, doing business as University Hospital, will be operating at the mall tomorrow. We do have about 1,500 doses that we had at the hospital, but it's only going to be for their vulnerable patients and for teachers and frontline workers. It's all going to be gone probably by tomorrow, maybe have a little bit less. So if we don't get that shipment in sometime tomorrow or Tuesday, we're not going to be able to continue the program. So it's very, very frustrating, and hopefully things will get in here pretty soon. I was talking to Aaron Eppley just a little while ago with Strack, and asking him how we doing with the IV infusion program out at the Coliseum. I remember when we first started, we were doing like 8 or so, and it got up to 20 or so, and now we're doing 90 a day. And I believe the IV infusion is helping us on our hospital load. The Eli Lilly COVID drug and the Regeneron, I think, are having an impact of helping people not get so sick that they have to go to the hospital. So we're going to keep up that program. That program has to be done. You have to have a prescription from your doctor to be able to get it. So if you feel like it's something that you really need to do, then you need to call your doctor and get a prescription. I think our 1,439 in the hospital is another record again in terms of the number of people in the hospital. New patients went down about 50, so that was good. But as you stated earlier, over 400 and some people in ICU, and I think we all know what ICU means. That's a very dangerous spot for somebody to be. So we've got to really be careful over the rest of this month. Like I say, we're at 1,439. There were some early predictions that we could hit as high as 1,900 by the 1st of February. Hopefully we will not do that. But it all depends on you, how careful you are with respect to the mask, with respect to the washing your hands, sanitation, keeping 6 foot away from someone. So just take some extra precautions as we work our way through this month.
Thank you, Judge. And we do want to remind you also there is a critical shortage of blood supplies. And if you are able to, we would highly encourage you to schedule a donation appointment for blood, particularly if you are type O. But all types are needed, and you can schedule an appointment at southtexasblood.org. Also, we know that many people out here are struggling through this pandemic. If you're having trouble paying rent or mortgage, the city and the county have an emergency housing assistance program set up for you. Get more information by calling 311 or going to the website covid19.sanantonio.gov to help to pay for rent or mortgage in this community. Also, if you're out of work, out in loss of income, we have a training program that allows you to train for jobs that are available right now in our community while you receive a stipend to help make ends meet. Again, you can get more information by calling 311 or enroll at 210-224-HELP. As the judge stated, we are not out of the woods yet. We need to cooperate to make sure that we save lives in this community during a particularly dangerous time. Please continue to mask up, practice physical distancing and proper hygiene. Do it for yourself, do it for your family, and do it for San Antonio. As always, you can get the latest on COVID-19 by texting COSAGov to 55000 or going to the website covid19.sanantonio.gov. And the judge and I are available for questions.
Hey, Mayor, with this particular delayed shipment, how much was coming in this shipment? And because it's being pushed back with the appointments 2 days, is this going to interfere with the second doses that people are already standing in line for?
You know, again, we hope that this is a very short-term delay. We were expecting, I believe it was 9,000 of the Pfizer, but I'll check that with Metro Health. It should not, you know, again, one of the things that we were doing is that we're not scheduling appointments for doses that are not already on their way to us or in hand. And so this shouldn't have any impact on second doses. Appointments for second doses.
You know, while we're having problems with the shipment, WellMed, they will be able to continue their work this week. They have the Moderna. We're waiting on both of us are waiting on a shipment from Pfizer, and so that is what's delaying us. And as the mayor said, it's supposed to be in somewhere between 18 and 20,000 doses, so to share between the two of us. Hopefully it's going to get in.
Did they say why it was possibly being delayed, or is that still a question mark?
I think it's a big question mark. I was asking, you know, George Hernandez, what is the matter up in Washington? Because I think of a lot of good reasons what's wrong up there. But I don't know whether he didn't know whether it's a manufacturing problem with the private sector or whether it's the federal government problem. But it's obviously a big problem.
Yeah, and we aren't the only community affected either. The Pfizer shipments are being delayed in many locations around the country. In fact, I think there's a lot of news reports out right now about that. So we're going to continue to push and try to get these in as soon as we can.
How long can our hospitals hold up with the numbers increasing and going up this high?
You know, again, we talk about this a lot. The hospital system in San Antonio is large, and because of the volume of resources they have, there's a lot of triggers that they can pull to create capacity. One of them is to stop doing elective procedures. Well, they've already stopped that. One of them is to augment staff and bring more staff in. They've already done that. In fact, we have, I think, over 1,300 nurses and other medical professionals from outside of this area augmenting their staff. They've pulled almost every trigger they possibly can. We have capacity to treat the ill right now, but you know, again, this can't go on ad infinitum, or there's going to be a point at which every system breaks, and we don't want to reach that.
Are we right now here in San Antonio, are we at any risk of our hospitals being overrun with COVID-19 patients?
If infections continue to rise and we continue to see numbers like we are, and you know, a couple hundred admissions every single day, there is a breaking point, and we don't want to reach that. And we'll have our hospitals in here to discuss a little bit more what goes into that capacity this week.
We do have the field hospital out at the Coliseum as a backup, but that really does not want to be used because everybody knows you should be within the four walls of the hospital where you have an array of services. But if it reaches that point, it can be used for those maybe that are not quite as sick as some of the others, but hopefully we'll never get to that.
Is there any good news? Is there anything that you guys see working? Anything Metro Health has mentioned? People are starting to move out of the hospitals a little bit quicker than they were maybe a year ago?
Yeah, I'll just add what I think is some positive things that are going on. Number one, people are getting tested. We're seeing a lot of testing continuing to happen. That's very good because that allows us to identify the infections, isolate them, treat them much faster. I'd also say that, again, the county and the city have set up operations that push out vaccinations, administer vaccinations very effectively and very quickly. We just need more supply.
Yeah, I think we were one of the first in the nation here in San Antonio to begin that. I know I was over in Houston, day before yesterday, and they're doing that now at the stadium, and I'm sure they're having the same problem we have, getting enough supply to do it. If we had enough supply, we could be even expanding some of the capabilities of doing more vaccines, but until you get a identifiable supply, you just can't jump up and start something new when you're having questions about handling what you got right now.
I know you all mentioned the supply of the vaccine being a major issue when it comes to getting as many as there is demand. Has there been any conversation of what you guys need to show in order to get more of the vaccine, or is that more of a federal level decision at this point?
I mean, we're showing what we need to. The fact that the vaccines that are being distributed to Bexar County and San Antonio are getting administered as effectively as anywhere else. So we also, again, know that our population is disproportionately vulnerable in the 1A and 1B categories. So we're doing. The community is showing what it needs to in order to get more vaccines distributed to San Antonio. We just need leaders to do that.
The state knows how well we're doing. I think we were listed at one of the key ones. So just between City of San Antonio with University Hospital with WellMed, I think we were doing like 4,500 a day or so. So we're well organized, and their whole thrust was, if you're going to get it, use it. We've been using it better probably than anybody has.
Yeah, and I got numbers on today from the week of administration at the Alamo Dome. We had over 10,000 vaccines
That's good.
Administered at the Dome last week.
We have a few questions actually that have been texted in. This one's for both the mayor and the judge. Health officials across Texas have criticized Governor Abbott's pandemic response, saying it hasn't been aggressive enough and hasn't given local officials the authority to implement policies that will slow surges and prevent deaths. As local leaders, how do you both grapple with that more relaxed approach as you watch case numbers grow in Bexar County? Has that mixed messaging from the state made it harder to keep the pandemic under control here in San Antonio? If so, how so?
You want to take a first shot?
Sure. Yes, undoubtedly it has. And the mixed messaging from the non-pharmaceutical interventions that we had originally had authority over at the beginning, to the use of mask wearing, to the fact that we've been restricted from now doing any kinds of non-pharmaceutical interventions that the governor doesn't first authorize. There has been a tremendous amount of mixed messages. Which is why you see the judge and I on here every single day appealing to what we have been from the start, which is our public health authority's guidance. That's been our foundational approach to containing this virus, but that's been made infinitely more complicated by the state.
Well, there is mixed messages, but even at the federal level, it's even worse. With the President of the United States to run around refusing to wear a mask for a long, long time, having a reception at the White House and nobody wearing a mask there hardly, and of course it spread out. So a lot of mixed messages that was going out. I don't like to use a rearview mirror to think that I was right about something. I like to say what I did say then and what the mayor and I both said. The biggest mistake the governor of the state of Texas made was taking away our mask mandate. We know there's 3 important things to do, and that was 1/3 of it. When he took away our ability to fine someone for not wearing a mask, and then he came along after that and put in place, you got to give a warning, and then it's $250. He put in place something that you really can't enforce. What we've done at the local level is did that with the businesses, and we worked hard to do that, and the city and the county's been enforcing that. We've had good work from employers, but still, once you walk out of there and you get in a social gathering or wherever you want to go, you know, people are not going to worry about getting warned and then having to get caught the second time there. So I think that was by far the biggest mistake he made.
There are reports out of Laredo that they're not accepting patients anymore due to the COVID surge. Hospitals have reached capacity there. Do we know if our region is expected to receive any patients from Laredo?
I do not know, but I will phone Strack immediately after this briefing to find out.
You know, I think from El Paso, which is, of course, a lot further than Laredo, I think we had 78 here at one time. Now I think we're down to 1. So we don't really have the capacity to take in COVID patients from somewhere else. We're going to be struggling to make sure we take care of what we've got here within our own hospital area that we're responsible for.
And as it relates to the Pfizer delay, if appointments were scheduled for Wednesday, is everything just being shifted 48 hours later?
No, so the only appointments that are being affected right now are those that were scheduled on Monday. Those are going to shift to Wednesday. In fact, Monday was the only day that was scheduled at this point because we wanted to make sure we had them in hand. So, you know, I know there is frustration about scheduling appointments, but it's precisely for this reason that we've had to be very careful about not scheduling appointments for doses that we don't have in hand yet. So the only disrupted appointments at this point are Mondays, and those are just going to shift to Wednesday.
Yeah, what we're doing out there, we'll be doing teachers and frontline workers in the school districts and vulnerable patients for the whole week. So they will be impacted if we do not get any more vaccine.
All right, thanks, y'all.
Thank you.